So welcome. I'm going to present some work that was done by myself, David Blar from the University of North Carolina at Charlotte, and two colleagues from the University of Louisiana at Lafayette, Mara Salam and Dr. Ben Kern. And so we were interested in studying the effect of cell phone use on social interactions and physical activity in college-age students. A little bit of background. We know that cell phone use among college students is at an all-time high. For those of us who walk the halls at a university regularly, we're pretty accustomed to the students being face down in a smart device and not being very aware of the world around them. That's just part of growing up in the here and now. Our college generations coming up are really grown up in an app-centric world and have had access to smartphones for most of their lives, and soon they'll be a whole cadre of new generations of college students and high school students, etc., that are completely, app native. And so this is just a reality that we're going to have to continue to deal with. We also know that cell phone use inhibits face-to-face social interaction, and there's some evidence that suggests it might inhibit physical activity. And for college students, we know that they're already deficient in terms of being physically active enough, and so that is a significant concern. And so that's why we decided to undertake the study that we did. So we had 56 college-age students volunteer for the present investigation. They were selected out of a SONA database system and then randomized into one of four groups. Those groups, which we'll talk about a little bit more in a minute, when they arrived at the lab, they were shown into a room. We kind of called it the holding room, where they were administered the positive and negative affect schedule. And they filled that survey out, and then we described that they were going to be moved into a room where they were going to be asked to wait for a period of 10 to 15 minutes as we would then bring them out of that room in the groups to finalize the study. And so really we had the entire group moved into the next room simultaneously, and then we would bring them out two at a time to complete data collection afterwards. And so when they came in, we had two groups that, as they were being told they were going to move into the treatment room, we told them that we had to collect their cell phones because there was sensitive equipment in the room next to them that could be damaged by cell phones, and so we had to keep them in a secure, locked safe in the original room. And so two groups of individuals surrendered their phones to be held in a secure fashion, and two groups went into the next room with their cell phones intact. And so they went into that waiting room, which was actually the treatment room, because this study did involve a bit of deception. We monitored them for 10 to 12 minutes, and we had video cameras set up around the room so that we could record every student that was in the room. We didn't have any blind spots in the video. And that room was either set up with or without physical education equipment. And so that's how we derived our four groups. We had two conditions, cell phone and no cell phone, and then another two conditions, no equipment or physical education equipment. So we monitored that video for 10 to 12 minutes, and then we stopped the video at that point and started to bring the participants out of that room two at a time back into the original area, where we basically collected another positive negative affect schedule survey from them, and then we debriefed them, letting them know that we had applied a deception, that the real purpose of the study was to see their interactions in the room with or without cell phones and with and without physical education equipment. While they were in the room, we were looking at, we were recording the video, but the intention was to use a modified version of the system for observing children's physical activity and relationships during play, so the SOCARP instrument, to then code that information afterwards. And so we're going to present the physical activity piece from that coding, but there's quite a lot of data that comes out of that system. So just to kind of completely clarify, our groups were 1 through 4, no cell phone, no physical education equipment. Group 2, no cell phone with physical education equipment. Group 3, cell phones, no physical education equipment. And Group 4, cell phone with physical education equipment. All right, so this is what the room looked like. It's a fairly large space. And you can see we've got jump ropes and balls and barriers and things spaced out throughout the room, kind of randomly, a football in the middle of the room. We did photo document the setup for this so that we could duplicate it into two groups that had physical education equipment, just to the best that we could. But we did make sure that we placed the equipment in approximately the same place when we had the exact same equipment out for both physical education equipment conditions. All right, so on to our results. And so we'll first talk about the positive and negative affect schedule survey results. And so this is analyzed pre to post using a repeated measures ANOVA. So the positive affect data showed no significant difference by group, so no main effect for group, and no significant interaction effect for group by time. But we did have a significant main effect for time for the positive affect across all groups. And we'll talk about that when I put the raw data up on the next slide. The negative affect data really didn't show us anything. We had no significant main effects and no significant interaction effects with the negative affect data. And so these are just the means by time pre-post. So you can see for the positive, we had a pre-value of 26.6, which declined by about 3 units to the post. And that's what gave us our significant main effect for time. And you can see that the negative score didn't change very much. Most likely we were seeing that the participants were kind of getting bored with having been around the building and in the lab filling out surveys for being stuck in the waiting room for up to 15 minutes, and so that's probably why we saw a decline in positive affect. For our physical activity, if we look at the SOCARP instrument, we kind of coded people from sitting, leaning as low scores to standing, walking, and very active. So being very active, vigorous jogging, etc., being a high score. We did see a significant main effect for both group and time, as well as a significant interaction effect for group by time for physical activity. And when we did a post hoc analysis on the different groups, we found that the 4 groups were different except for group 1 to 4. So the no phone, no equipment versus the phone and equipment. Those two were not significantly different. And if we look here at the results graphically, we can see that one group clearly had a pattern of physical activity that was greater across the time of video recording than others, and that was the no cell phone plus physical education equipment group. So that group was by far and away more active than the other groups. The other groups basically did nothing. You can see that they basically have a near 0 score. Some people were kind of standing around, but as opposed to sitting, but for the most part, not a whole lot going on there. We can see that the no cell phone plus physical education equipment group was moving around and being more active. And anecdotally, we can report that that group was also interacting with the physical education equipment and also interacting more with their peers in the room than the other 2 groups that were basically mostly just sitting around the room. The 2 cell phone groups were basically sitting looking at their phones the entire time. The physical activity data that's on the far left of the screen is just the students moving into the room where we're picking them up on the video and noting which student ID is who and then tracking them. So that's really artifact data. What we really are interested in is what happens towards the latter half of the minutes of this. All right, so in conclusion, we can see the results of this study suggest that the use of cell phones may inhibit physical activity levels in college students. And when you would expect that their physical activity levels would be higher, when we gave them physical activity equipments, the introduction of a cell phone blunted any sort of physical activity increase you could have expected to receive from equipment availability. Right, we also saw some changes in social interactions. The group that was most active also had interactions with the physical education equipment and other students in the room. And so that definitely is evidence of detrimental effects on both physical activity but also social interaction that can be engaged in through physical education. More research is needed to fully investigate the health consequences of cell phone use and how cell phone introduction in an earlier age further influences behavior in terms of physical activity levels and social interactions as that those young individuals move into adulthood, particularly to the age of this particular subject section, so college-age students. So thank you very much for your time and attention, and I'd like to thank my co-authors as well as support from the University of North Carolina, Charlotte and the University of Louisiana at Lafayette, and thanks to Shape America for allowing me to record this video and present it. We are very excited about the results of the study, and we're looking forward to getting more of the data out from the study as we have time. Thank you very much.